Welcome to Catalyst for Healing. I'm here today with Dr. David Richter. He runs the Ketamine Clinic in Seal Beach for Renew Ketamine. And Justin isn't here with us today, but he is going to walk us through an IV ketamine treatment with me from start to finish, because we want to show people what the experience is like for them. If they're worried about doing this, we're going to show them what to expect from, coming into the clinic, starting the IV and after. And David is actually trained in psychedelic support, so he will walk me through setting an intention, how to kind of set that up before we start, and then also some integration after. So I hope you enjoy our experience today. How are you feeling about this?
Good. Thank you for having me.
Yeah.
I think this is a fantastic opportunity for everyone, just to kind of demystify everything a little bit for everyone and just show what this treatment is really about.
Yeah. We're both really passionate about it because we just see how much it helps people that really need it.
Absolutely.
And I've been vulnerable throughout the podcast about my own history with depression, and I felt that this was an important time to do this because I'm kind of in the process of getting divorced and about 3 months in the process. And what people don't realize, and about 50% of people have gone through this and they really understand. In fact, I see looks of compassion from people when they've experienced it. It is one of the most stressful experiences you can go through. And it's been a real struggle. And I have noticed my symptoms of depression coming back, and when I notice that is I often get ketamine boosters as part of my treatment. And so I told Justin and Dr. Richter that I wanted to film it just to help other people who might be again, not really sure how this process works, but also just to share a little bit about grief and about loss and change and how much it affects the nervous system. So for me, I feel like I've been in a state of fight or flight, and I know you've been through a divorce too, for the last 3 months, and the amount of stress, I just feel like nobody told me how hard it would be in terms of from, talking about getting divorced, to telling the kids about the divorce, to selling our house, to moving, to mediation. I mean, the amount of stress that toll has been on my body is like immense. I can't even put it into words. But
and I would segue on that, because that's a little bit what we're trying to do with the way we practice. That is actually the key element, that it's very difficult to be prepared to something that you don't know how to feel. Right?
Yes.
The empathetic side of you cognitively understand what you might be going through,
Right.
but until you are actually involved, whether you're allowing yourself to feel and emotionally be involved in the process, or shielding yourself off for the sake of actually being able to be functional, that's
Right.
something that's individual, right?
Yeah.
Because people have different perceptions of all of these elements, of all of these actions and all of these steps. So what one person obviously feels, another person will feel differently. And that is something that is so key about realizing about healing. It is a perception of how you're healing, and it's individual perception.
That's a really good point.
And so from my perspective, and I've been through that, I've been through a divorce myself and other struggles, that's where in hindsight you realize, no one could prepare me for this. No
Right.
one could tell me how to feel.
Yeah.
You have to make that for yourself. And that's where I feel like the element of healing can come in.
Yeah.
To understand your own feelings and to perhaps build with that.
Yeah.
And that is as individual as you yourself and as me.
Right.
Yeah.
And there's no time frame. Like, this is grief in general. Like, I don't know how long I'm going to be in this process.
Right.
But what I do know is that I was in so much, needing to get stuff done while I'm working and dealing with all these changes, that I was kind of, I think, shoving the emotions aside just to be able to do all those things.
Absolutely.
And so the minute some of those things settled down was when I just felt like the emotions were crashing, and I was unexpectedly crying, out at dinner if I saw a family, because just grieving that the family's broken up. There's all these different elements of unexpected emotion. And I think people don't realize how much of a toll I think it takes when you're dealing with grief. I mean, every grief and loss and change is, it's a difficult process. It's a difficult process on the mind, on the body. And I canceled doing the last podcast because I was so exhausted and overwhelmed with the changes that I couldn't function. And it was 2 weeks ago where I just started noticing my symptoms of depression. So for me, just because of my history, I'm always very, very careful to look for those things. But you know, lots of crying that wouldn't stop, and not sleeping. I've lost a lot of weight in the last 3 months just because I don't eat that much, and not eating was getting bad. And then I really couldn't concentrate. Like, you know, I was showing up for my clients, but it was really, really difficult. And so I just started getting to the point where I called Justin and I just said, I think I need to get in for a booster because I'm worried I'm going down, you know, deeper. And for me, when I go deeper, it can take a really long time to get out of it. And that's been the gift of ketamine for me, is like, when I'm in this space, I feel like it just, one, helps me to do a lot more of the processing. So I'm hoping for today that I can do more of the processing of the grief in a way that's very calming, because the medicine gives you that sense of like, you're going to be okay. And then I'm also hoping to be able to see the other side, because it's hard to see that yet. And so anyway, that's my intent with like sharing this and wanting to be vulnerable, because I think a lot of people are still resistant to getting these treatments, and I just cannot tell you how much it's honestly changed my life. And the timing couldn't be better, just because I feel like I really need it right now.
I do want to thank you, Maria. This is something that I also feel like we're so quick to not want to understand, because I've worked in different healthcare environments, including emergency department, and that's one thing that I always, and it wouldn't be also if I weren't exposed to it myself, just like any other human next to me, is you can't explain how intimate feelings and emotions are to an individual, right?
Right.
And that's where a lot of what we do is, you know, you've been providing therapy for a long time. You're well read, you're well educated on the cognition of different techniques, how to, you know, help people with different state of minds,
right,
different symptomologies, different diagnoses that stem from that, right? The one thing that I feel like has been truly difficult in healing is to trust the idea of the empathetic, emotional state of being of the individual. And for obvious reasons, because a lot of times in healthcare, it's difficult for the client and for the provider to be emotionally attached, right?
Right.
In fact, that's been the status quo taboo, right? But we're realizing more and more that a certain level of empathy stems from emotional understanding and connection. Provider and the client, and vice versa. And that is something that you can probably segue into that. We're struggling in healthcare so much.
Oh my gosh.
Right? So that's where,
even when I shared my earlier ketamine treatments, were just like putting me in a room and not talking to me, and that was traumatic for me. And it's like, just this exchange right now is making me feel calmer.
So
and
Maria, so I want to thank you, because to be vulnerable with the most intimate thing we have as humans, that's incredible. And incredibly beautiful.
I struggled with that, but I felt like it was important, because I want people to be able to do this treatment.
It's part of what we do.
Exactly.
It's part of what we believe in, right?
Yeah, exactly. Authenticity.
Absolutely.
But yes, and so anyway, I want you to walk through like a normal process, like you would with any client. And I think we had talked about, you know, maybe segueing to just having this little discussion to share with the podcast my process, but also you go ahead and take over with what you do. I'm just going to be a normal client.
Well, thank you for all this.
Yeah.
So what we do usually is, you know, I greet all of my clients. We go to my office. We're in the infusion room right now. It's easier for us to interact this way and actually in the office, I usually, actually, if it's for the first time that I'm meeting with clients after consultation over the phone, I try to gather, really just kind of to resettle them. Why are they here? What kind of mental state they are in at the moment? Because it will vary from, day to day.
Sure.
And just kind of to prep them very quickly as to what to expect. And they already have all of this information, so they have read, they have watched a video maybe as to when we talk to them about the process.
Right.
But we take care of everything in the office when it comes to the administrative parts. We have people fast for 4 hours before they receive the infusion, just to make sure that they don't have any unwanted side effects, and make sure that their vital signs are good, and that we're really ready for the infusion itself.
Mm-hmm.
That's the kind of administrative part that we take care of. But I also already start gauging where they are at in the day. They might be coming in the morning, they might be coming in the afternoon, they might have worked before they come in, or they might be going back to the family or the stressor, or whatever it is.
Right.
The one thing that we focus on already starting at the doorway when I meet them is to try to have them settle with themselves.
Okay.
Leaving all of the expectations, the biases, all of the preconceived notions at the door, and we'll work through that as we go on.
Yeah.
But that's already my aim. They're here, my clients are here for themselves,
Right.
because they want to try to truly, intimately understand themselves, especially their emotional states and everything that stems from it, right?
Mm-hmm.
So that's where we start. Being able to almost allow yourself to just simply be like a blank canvas.
Yeah.
Allow yourself to explore no matter what comes your way.
Okay.
So we start with that in the office. We take care of all the typical things when it comes to make sure that check boxes with the vital signs and the prep.
Right.
And then we take care of the payment, just make sure that the informed consent and everything is in. But really, at that point, I have them use the restroom if they need to.
Okay.
And then we come, I usually do the infusions here in the infusion room. I have in my office an infusion chair. We've had windows in the office, it's a little bit more open.
Yeah.
But I really try to do it in the infusion room here,
Yeah.
because I don't have windows here. I dim the lights and you'll see the whole process. It allows the client to truly be, I am okay within this space alone, without any further distractions. I try to minimize the distractions. You'll see the entire process. A couple of plans just to keep it more serene. But the point is, the focus is on you.
Okay.
This is all about you. I'm not really introducing anything that isn't already in you.
Yeah.
The medication really allows you to just have potentially a unique insight into your own emotions and the cognition that stems from it, and they go hand in hand.
Yeah.
So we start in the office, and we transition here, and basically here we'll take the vitals. So I'm here always with my clients, with my nurse. Today it happens to be Samantha, so I want to introduce
Samantha, one of
her.
the registered nurses here, so
Samantha's
nice to meet
awesome.
you.
Yeah.
Okay.
She helped me create this environment, for sure.
It's a very, it's beautiful, serene environment.
Yeah, we don't have any overlap with other clients. I really try to create an environment that allows our clients to focus on themselves, because this is about them. This is the most intimate them that they're potentially going to explore on their own.
Yeah.
There's no camera in their brain. There is no recording in their brain.
Right.
This is all about them and what they're about to embark on. The journey, as we call it, basically.
And
So,
this is what I love is you guys, you're here from start to finish,
Yes.
right?
Mhm.
And a lot,
Always.
and other, clinics might do it differently, but having that consistency,
Yes.
I know for me is like really calming to know.
Absolutely, yeah.
I'm
It's-
not gonna just be put in a room and then maybe someone else is gonna.
It's what we talk about, right? That rapport is important,
Yeah.
right? You want to be able to, even if you don't trust yourself, you might be, putting out the feelers to what can I trust.
Right.
That's what we try to create here.
Okay.
The safe, trusting environment that allows you to trust yourself,
Yeah.
your own journey,
Yeah.
right?
Yeah.
That's what we do here.
Right.
So we might as well, I think, get to it,
Yeah,
right?
so we like to go ahead and start off by giving you a sublingual Zofran. This is
Okay.
just a nausea medicine, it's really safe. Do you have any allergies to medications?
No.
Okay, so this just goes under your tongue, dissolves to prevent any possible nausea that you might experience. Usually it just kind of keeps it from occurring.
It's very rare, these side
Yeah.
effects. It's more of a preventative measure because
Yeah.
it is such a safe medication.
Okay.
So it's really easy to just, again, I don't want my clients to have any other distractions.
Yeah.
This is all about them.
Mhm.
So we just try to prevent
It's not
any
that rare though,
distractions.
right? Like I'd say a lot of people get nauseous.
If you get this prophylactic treatment, and we've been doing it for years,
Yeah.
I have not observed anybody really
Oh,
having that reaction.
okay.
Without it, it depends,
Yeah.
right? How long they have been fasting, what did they eat the night before?
Yeah.
Where are the comorbidities, medical health care, and we do all the screening. So it's not that common, but with the pre-treatment, we just get away from that. Then
Makes sense.
with the treatment, pre-treatment, it's actually pretty rare after that. So that's
Okay.
why we just, unless there is some hardline contraindication, which there really usually really isn't, unless you specifically have allergic reactions to this.
Right.
It's better to
Okay.
just get it out of the way.
Yeah.
Easier to prevent than try to
Chase it out.
Yeah, exactly.
Yeah, that
I
makes
agree.
sense.
So,
You're on now.
Okay.
Oh, we're on. Okay.
you
Okay.
can always say.
You can cut.
So yeah, so you prefer the IV on
Got it.
the right arm today, right?
Yeah, that'd be great.
So we could grab one of maybe that pillow, just to use it as support. And then we have a couple pillows and blankets and things. I'll just put this under.
Okay.
To use to kind of bolster. And some people get a little cold. They like the blanket. Some people are hot. They don't. Whatever you prefer.
Okay.
Feel less comfortable.
Now I've done this before, but I'm just pretending that,
Yeah,
this is
no,
new
absolutely.
for me.
Right. Exactly. You said run through it like as if it was a regular
Right.
patient, right?
Yeah.
And just to chime in as we're getting ready for everything, I like to do this with the clients, after we take care of everything in the office and we really just try to settle. When I get you in the chair, I really would just want to take care of the, obviously the unpleasant things out of the way.
Yeah.
Before we even set an intention and really try to explore anything, put the IV in, get the medication ready, get everything ready, get
Yeah.
you comfortable, so then we can really just focus on you. So
Okay.
I usually do this with the patients where I really just get everything out of the way first.
Yeah.
And then we can actually do a little bit of a preparatory session.
Okay.
And that immediately segues into the infusion treatment itself.
Okay, sounds good.
And are you nervous with needles or?
No.
Okay. Some people like a little 1, 2, 3 warnings. Some
Oh, yeah.
people don't. So
I'm sure.
I just try to
runs the
ask.
gamut.
Yeah.
I just like to close my eyes.
Sure,
1,
yeah.
2, 3. Let's still give it to you.
Yeah.
You did great. The needle is out. The part that stays in is just a little flexible plastic catheter, like
Okay.
a little straw in your vein. So you can bend your arm. We keep an eye on it during the infusion to make sure it doesn't pause the infusion. And this is not any medicine I'm injecting right now. This is just normal saline to make sure the IV works well. Clean that little blood out of the tip of the catheter, and then we'll tape it down. So we don't surprise you with the infusion. We'll make sure that you know when it's coming.
Okay.
Is that comfortable the way it is?
Yeah.
Okay.
And all of this, we're just really trying to, create the environment where you can really just focus on yourself, right?
Yeah.
We're really just these, quote unquote guides that really just try to kind of allow you to have that experience. So
Right.
with the music overhead, with everything, really all I'm trying to do is for you to be comfortable with yourself
Yeah.
as much as we can before we actually do the treatment itself.
Right.
Yeah.
Because it's a journey into yourself. The whole experience.
Exactly.
Yeah.
Maria, you've been through it.
I know.
You know. But at the
Yeah.
same time, that's one of the things that are really important to realize also. If you have a certain expectation, you're already perhaps limiting yourself.
Right.
So that preparatory session, I don't care how many infusions you've had or boosters and how
Yeah.
many treatments, it's always good to start anew. You might discover things you
I
never
love
even
that.
thought
That's
about,
true.
right?
Yeah.
Every day is
Well,
different.
and I think the idea of I can have my intention, but at the same time, be in the moment and surrender to where it takes me, because it's going to decide on its own.
Exactly. You are actually going to decide.
I will decide. That's a good way of saying it.
Exactly.
Yeah.
So now what we do, once we have the IV, I just have you sit for a little bit. We prepare the medication. We set everything up at the pump.
Okay.
And then we'll actually do a little bit of a take-seat meditation exercise preparatory session,
Okay.
segueing into the infusion. Okay.
Now go ahead and just get a set of vital signs. We like to check your pulse, as well as your oxygen level, and then your blood pressure.
Okay.
Do you mind if I take your watch off, or would you?
Yeah,
prefer
no,
that?
that's fine.
Okay. Is it just stretchy? for.
I'll just pull it there. Yeah.
I like that. That's cool.
Do you want to take your shoes off, Maria?
I was just thinking they're not going to be that comfortable for
I
laying
try
back.
to really like all of my also clients. I'm like, take your shoes off. Just be here.
Thank you.
All right. Be
Okay.
yourself the way you came.
You want to be
right?
comfortable.
Yes. Be comfortable. Yeah.
I do like this room. It's
I know.
very, like calming.
Do you want me to leave? Do you want me to stay here?
Honestly, most of the time, the infusion chair in the office, I don't use it because I really just always have only one client at a time here.
Yeah.
But if people don't feel comfortable in this room, that one's a little bit more open. It's got windows. At least for the preparatory session, it might be easier for them to segue.
Yeah.
But most of the time, after we do a little preparation, meditation, people are comfortable in there.
And not having windows is nice. It's probably really
There's
dark.
a different effect to it.
I bet.
for sure.
Yeah, you're not
absolutely.
like kind of peeking through
You
the
don't
mask.
hear the street noise either or anything like that.
But I understand that it's good to have options for both, basically. Yeah. All right, just
Measuring over.
Well, so it actually worked.
Oh, good. Perfect. You got good vitals.
Okay, good.
Good vitals.
I was worried it was going to be
I
hot.
was getting me trouble earlier, so. And like I said, once we drop the medication and we'll put it on this pump and I'll even connect it to you, but I won't start it yet until after you guys are finished.
Okay.
Kind of just getting in the right mentality, kind of getting relaxed, going through
Okay.
that whole process, just so you know when it's coming.
And so, Maria, this is now off the record, but
Yeah.
we didn't weigh you, which
Oh,
we
yeah.
normally do,
Okay.
which we should.
I'm okay with that.
Okay. It's, again, the medication is per weight.
Yeah,
so
yeah.
we should,
But I think you guys have it from. For me, I'm getting more than one booster, so I got another one last week.
So I
just
gotta weigh you because I don't have access to their EMR.
Oh, you don't? Okay, good.
You don't have to look at it.
That's
Wait,
fine.
Did Justin text you the dose?
Yes,
Oh, the
I
dose
have-
per
Yes,
kilo. Okay.
correct. Yeah.
Oh,
You just step on it.
Okay.
Don't worry about it. I got you. That's good. Perfect.
That's probably one of people's least favorite things is getting weight, but
Yeah.
I guess right now I'm not worried about it because I haven't been eating much. Okay.
And again, the medication is incredibly safe. So these are all just measures to make sure that nothing else is here to distract you from the
Right.
experience, from the journey itself. Yeah.
Oh, I think I need a pillow if my arm is stressing.
Yeah, so if
Oh,
you
yeah.
wanna,
We
a lot
have
of
more
different
pillows
ways to
too. We have more blankets, whatever you feel like, and we'll go through all
We'll
of them.
kind of like.
It's a hot
we'll
day
look
today in Southern California.
It
So I don't
is-
think I'll need many blankets.
I know most people don't. Some just like that sensation of something on top of you that feels like grounding. We also have here.
Oh yeah, and
the
this
hot
one's really
stones.
light.
Yeah, they're very lightweight. We also
Okay.
have the hot stones as well. Some people like that.
Oh, that's
Usually
cool.
they do it maybe on their second or third after experiencing it the first
We'll
time.
we'll incorporate it today.
Okay,
I
we
really
can
feel like it's a good.
incorporate it, yeah.
We'll go through all
Just
that.
kind
Yeah.
of a grounding in case you start
Yeah.
feeling a little like you're floating or you need something to
That's
kinda hold
actually
on to
cool.
to
I
ground
didn't
you
know
a
you-
little bit.
yeah.
And we'll
You
go
guys don't
through
have
it.
the stones at the other clinic. It's a nice touch.
How many
I am.
sorry, you're doing the math.
No, yeah. Just to kind of take the viewers through it. So
Okay.
have you sit here, I basically just, at this point, we're just having you relax with the music, get yourself comfortable while we basically set everything up, prepare the medication. Like I said, get it out of the way so then we can actually just focus on you.
Okay, sounds good.
Yeah, the medication is diluted in 15 cc's or 15 milliliters of fluid, which we then give over a 40-minute infusion. So you're getting a constant, steady dose of it on the syringe pump over the 40 minutes. It's not just a one-time bolus dose,
Okay.
like if you got an IM injection in your muscle.
I'm just thinking if people are listening to the podcast, this might be a good one to watch on YouTube.
Yeah.
Because it's going to be hard how it comes across, verbally, but at least with the video you can see because we're all kind of moving around. And
Right.
this music is very calming.
Yeah, I found a playlist that I feel like really works to be able to go into that weightless space of self.
Hmm.
That's what I lead with, basically.
So Dr. Richter's just drawing up the dose of the ketamine that's weight-based.
Okay.
And then I have the syringe here of the normal saline that we diluted in. We mix it up and we'll put it on our syringe pump.
And how long is the ketamine actually going into my body?
40 minutes.
Okay.
Yeah, usually what happens, just finishing up here, but usually what happens is the first 5 to 10 minutes maybe of the infusion, you might feel only light effects as the medication is starting to work.
Mm-hmm.
But then it also takes about another, after the 40-minute infusion, another easily 15 minutes
Mhm.
for the residual effects to wear off.
Okay. And I guess just to share that, you know, normally an induction is 6 ketamine treatments in 3 weeks, and that gives people the base. I never did that because I did the Spravato, which was the nose spray, and that was the twice a week for a month, once a week for a month. But after you have either of those protocols done, I'm finding it all over the board with clients in terms of how often they might need a booster, and really kind of looking more at like the signs and symptoms and try to catch those early and get in. But for me, I scheduled 2 boosters because last week it just wasn't quite enough. And then I also, just with so much going on, kind of thought I could use a little bit extra of the medicine. And could you explain that? Like, is there any risk with using the medicine
Right.
as needed after? Like, how does that
Right, so
work?
ketamine is a really stable, safe medication when it comes to that. It can be very powerful,
Yeah.
depending on the dose.
Right.
Now, when it comes to safety, this medication, and you've already talked to Justin,
Yeah.
you know, at the podcast and everything,
Right.
and he's gotten, you know, his medical side of things as well. The medication has been around since the 70s, heavily used in sedation and anesthesia and pain regulation. So the safety profile has been well established.
Yeah.
On top of all this, it's been used because that's how it was found and researched for heavy sedation and anesthesia and analgesic effect, right?
Okay.
So the doses that are used for that are much higher than what we use to bring out the psychotropic effects of the medication. And that's for another podcast, but in general,
Yeah.
you're already starting with a much lower dose.
Okay.
And my theory, and I think that's a working theory as of right now, because of the type of receptors that the medication works on, it's very difficult to see the psychotropic effects at high doses. Because in a way, you quote unquote, you knock the brain out. You sedate it, right?
Yeah.
If I just completely knock you out, there is not much activity going on,
Yeah.
right? And that's also perceived activity in your brain. Wow. We started to see through the research as it was used in lower doses, oh my God, it's got a lot of psychotropic effects.
Yeah.
We didn't research before, right?
Yeah.
The safety profile has already been established, well established at much higher doses.
Yeah.
But the psychotropic effects have not been observed.
Oh,
Now we're
interesting.
observing them in lower doses because during the infusion, we're not giving such high doses to completely sedate.
Yeah.
Quite the contrary.
Yeah.
This is where the individual infusions come in. The safety is there.
Yeah.
A lot of the times people talk about, you know, like addiction potential and potential side effects. We're talking here a controlled infusion, you know, let's say induction of 6 infusions,
Right.
and then doing boosters, whether it's on bi-weekly or monthly basis. In that sense, it's been incredibly safe
Okay.
at these doses.
Good.
We're
Because I always
talking-
feel like, am I gonna like hit a point where I can't
Correct.
do it ever again?
It's been observed to
Oh.
have some side effects, a potential rare side effects, but that has been researched on a population of street use. And that's, you're talking high doses
Yeah.
on daily basis
Right.
for months to years to come.
Yeah.
So you're talking a completely different population.
Okay.
Right. So in this setting,
Because
I
I
mean-
actually even haven't gotten a booster for like 5 months, and so.
you're talking.
But when I
the
hit to that
safety,
point, it's
yes.
like, oh my gosh, and I felt the depression. Like, I knew like it was so much better last week
Yeah.
right after. Again, it's like immediate.
Yes.
But
So-
I still feel like I need a little more,
Absolutely.
like to restabilize.
So in that sense, the tolerance, dependence, and safety,
Yeah.
the way we design our protocols, right? Infusing 6 induction series infusions and then, or 6 infusions for the induction series and then boosters, whether it's even once every 2 weeks or once a month, is what we usually observe if needed.
Yeah.
There are patients that go through induction series and they're good.
I
They
know.
wean off
I'm
medications,
seeing
and you know
that.
this, Maria,
Yeah,
right?
with the severe clients, I'm
Yes.
seeing they need about monthly boosters.
Yes. And in that population, this medication is ridiculously safe.
Yeah.
Like that data is
Okay.
already out there.
That's
so
good.
to put it to rest, it is
Yeah.
safe. Now, there are outliers and there always will be.
Sure.
But that's why we do it in our controlled setting in a clinic under supervision with 2 healthcare providers
Yeah.
with 1 client.
Right.
I mean, show me any healthcare clinic
Yeah.
that has that, right?
Right,
You don't
right.
have that kind of oversight and that kind of,
Yeah.
that's what we want to create.
Yeah.
I want you to feel safe as you can.
Okay. Thank
So
you.
that's definitely there.
Okay.
Yeah.
Cool.
So now we basically prepared all the medication. We're not running anything, and this is safe. This can be here for a long time.
Yeah.
But I like to do this before we start actually more focusing on you,
Okay.
right? And this is where I would say, and you've been through the courses yourself. You've done a lot of,
Yeah.
education for yourself when it comes to the therapeutic approach. All I try to do, what I talked about before, is to be able to focus on yourself.
Okay.
For the sake of the video, I'm not gonna turn off the lights.
Yeah.
But that's what I normally do.
Okay.
I turn off the light, that not to be a distraction.
Well,
either.
actually, we could because there's
There's
a
a
light
little bit
around
of
her.
light coming. Okay,
Oh, yeah.
perfect. Yeah. You can just
Right?
go ahead and turn it off for me there. So I
I don't know. Can you still see?
No, it's perfect.
Oh, okay.
okay. So even without this light, it just dims. It
Yeah.
allows you to just focus on yourself instead of the senses that we rely on. And vision
Right.
is the primary sense that we rely on, right?
Right.
So right now, Maria, we talked about why you're here, and
Yeah.
thank you so much for sharing all that with us.
Yeah.
All we're gonna do right now is we're just gonna, do a little take a seat meditation,
Okay.
and all I want you to do is just relax yourself back.
Okay.
And all I want you to do is take a deep breath in through your nose and breathe out through your mouth. Just a deep breath in again through your nose and breathe out. As you start, breathe in. As you start focusing on the breathing alone, all I want you to try is that with each exhale, just let everything go. Thoughts of today, what might happen, what has happened. Let that all go with each exhale. And just focus on your breathing. Breathe everything out. I just want you to feel each breath. The simplest of processes that we do unconsciously and keeps us alive. We take it for granted. Feel the air. Feel the chair. Feel your back. Feel as though you are allowed to let everything go with each exhale. Breathe. Whatever happens during the infusion, during the therapy, it all comes from within you. If anything feels uncomfortable or foreign, you can always ground yourself with breathing. You can always rely on your breathing. And slowly with each breath, allow yourself to feel why you're here. We're here for you. We're here to explore things that you feel like you want to be able to understand and feel. You might not be sure how. You can always ground yourself. do is you might be experiencing emotions, feeling of weightlessness. You can always ground yourself with your breathing, but just to feel like you can hang on to something that's close to you, I'm going to give you a couple of hot rocks wrapped in, just to feel that you're still you. You're still experiencing everything for yourself. Just focus on your breathing. Deep breath in and out.
Is that comfortable? Yeah.
memories of the boys, all different ages. Just grieving through the family that we were. All the good. There's so much good. I feel like I'm floating above the memories now. I just feel really peaceful, calm. I feel floaty, like I'm floating in the air. I feel like I'm on a cloud. Feel the medicine in my nervous system. It's like just feeling like everything's gonna be okay. Feels really peaceful, calm. I see myself picking up a paintbrush. And getting to create what I want with my life. Painting the ocean and the forest. Nature feels like it's surrounding me.
floating through nature. So beautiful. I can see the other side. It's gonna be good too. I just got a little puppy last week, and I just saw the puppy running. Puppy's telling me it's gonna be okay. Thank you, Simba. There's gonna be another side. It's gonna be good. Just between the music and medicine, I feel at peace, so much at peace. Everything's gonna be okay.
gonna be okay. Thank you. Expansive, colorful. I feel like these waves of peace and healing are just washing over me, washing the fires out. Waves are crashing the fire out. Peace and healing. field on the horizon. Just seeing a lot of sunshine, bright colors. Feels like I'm floating through a river. feels like a water slide. Whee! has landed. I know one of my clients said that, just feel like that. I was like, okay, I'm back. Wow, that was intense.
How are you feeling?
That was only 40 minutes.
Time, right?
Wow. That was amazing. Wish I could have video camera in my head.
We talked about that.
I know. That was really beautiful. Yeah. Okay, so I think we're going to wrap up this podcast and we're going to restart the next episode in a minute. Just take a little break.